but we're not there yet. And we've been saying repeatedly that this is not the time to let our guard down. But in fact, I'm going to say today, a challenge, it's time to double down on our safety precautions for COVID-19 until this vaccine is widely distributed. So why the cause to call you here once again? And it's real simple. The trends are headed in the wrong direction. If you look at the last 2 weeks, the numbers across the state of South Carolina have been clearly moving in the wrong direction. Now, here at the city of Charleston, I got to compliment our staff. They came up with an amazing protocol early on following the CDC guidelines about how to reopen and to monitor the science and to monitor the numbers in order to inform decisions that we might make as an organization, as a city, and how we operate in the midst of a pandemic. And those indicators included things like the new cases over 7 days per 1,000 residents. It included the growth in the number of reported COVID-19 infections. It included the trend in 7-day average of new cases. It included the testing of positivity rate in Charleston County. We didn't get the details of that by city zip codes, only by county. If you monitor all 4 of those key leading indicators, folks, they're all heading in the wrong direction. And you can see some a display of graphs and charts here to my left. So for that reason, I'm announcing today that just for our City of Charleston operations and facilities, we are moving back to what we call phase 2. We've been in phase 3 since early October, and this will step us back a little bit so that we will not be issuing permits for gatherings in city facilities for the next little while. If you want an appointment with any city official other than the permit center, you've got to do that virtually or make an appointment ahead of time. So we also will be once again going to our employees, and everyone that can work from home, we'll be asking them to work from home. So these measures apply to our own operations. They affect City of Charleston programs, offices, and facilities. Does not apply to businesses and organizations located and operating in our city. However, I want to challenge our community, our businesses, our citizens to look at every aspect of your safety protocols and how you're doing business, how you're interacting with other folks in our community to make sure that we're safe. Are we wearing masks? Are you asking your customers to wear masks when they come in your store? Are we following the hygiene protocol that's recommended by the CDC and our healthcare professionals? Are we keeping our distance? Can we avoid close contact with others that we're not sure whether they have COVID-19 or not? So again, it's not just time to keep our guard up or not let our guard down, but it's time to double down on our safety protocols regarding COVID-19. Yes, help is on the way, and it's beginning to roll out. So without further ado, I'd like to turn over to Dr. Pat Cawley with the Medical University to share remarks and also some more information about vaccinations. Dr. Cawley?
Thank you, Mr. Mayor, and thank you for having myself and Dr. DeLisi here today. I just want to reiterate a few points. One of those is around protection, the second one's around testing, and the last one's around vaccination. Charleston has been incredibly good since last summer when we had that very, very high peak. We've been very good about implementing protection measures as the mayor went through. Because of that, we have not seen the surge that the other parts of South Carolina have seen, particularly in the last 2 months. Now is not the time for us to relax. We continue to be in a little bit of a bubble here in Charleston compared to the rest of the state. We need to make sure we're doing all of the things that the mayor mentioned. Social distancing, masking, hand hygiene. All of those things are very, very important. They do result in less people being in the hospital. When there are fewer patients in the hospital, that means fewer people die. So all of those things need to continue to occur. The second thing I wanted to point out is testing. We would continue to encourage anyone with symptoms to get tested. That has not changed, but what is available now is that if you get tested and you end up having COVID and you're in a high-risk group, you should now get medication for that. The medication, which has only become available in the last 2 months, is very, very effective at lowering the possibility of hospitalization and potentially even death. So the message from myself and the other health systems and the doctors in this community is that if you have symptoms of COVID, get tested. If you are positive, determine whether you are high risk. And if you are high risk, contact one of the health systems for the monoclonal antibody treatment. The last thing I'll mention is vaccines. There's been a lot of activity in the past several weeks when it comes to vaccines. All of the health systems in the area, including MUSC, are very active right now in terms of vaccinating as many people as we can. We thank the governor for expanding who can be vaccinated today. At MUSC, we're prepared to start moving almost immediately to begin vaccinating the group that the governor has expanded to. I would ask everyone that when you begin to meet a group that has been okayed to be vaccinated, please get vaccinated as soon as possible. That is one of the ways through this pandemic, and not everyone's getting vaccinated immediately, but this is a good, safe vaccine. From the Medical University of South Carolina, we would highly, highly recommend you get the vaccine at the right time. Thank you. I'm going to turn over to Dr. DeLisi, who's the CEO of Roper St. Francis Health System.
Thank you, Dr. Cawley, and thank you, Mayor Tecklenburg, for having us, and certainly for your leadership of you and your staff for keeping the community here of Charleston so safe. It's so important, the message that's being given here today to keep everyone in our community safe. I started Roper St. Francis Healthcare just over a month ago, and when I started on December 7th, the number of patients in our health system that were hospitalized with COVID was in the low to mid-20s. Unfortunately, today, as I stand in front of you, we're up to around 90 patients. So the good news is that's still far off of our peak, which happened in mid-July, and we saw about 150 patients that were in the hospital. But obviously, that trend isn't moving in the right direction. So these steps that Mayor Tecklenburg has outlined are so important to keep us from hitting that peak. So important. And why it's so important to keep us from hitting a peak like that is that we need resources in the hospital to take care of the many patients that have needs that aren't COVID. The patients that need hip and knee replacements, where if they don't get those replacements, they're going to be sitting at home without the necessary treatment. For patients with stroke, heart attacks. There are so many conditions that we take care of in our hospitals here around Charleston and the community each and every day. And we need our staff, we need our resources to be taking care of all of those patients. So please listen to the guidelines that Mayor Tecklenburg has put out today. Continue to use masking, continue to do social distancing. And as you heard from Dr. Cawley, please, when it is your turn, get the vaccine. The vaccine works, it's effective. Now, I've been messaging to so many of our staff, reading the actual study from the vaccine, there's one graph that just sticks out in my head. There's two lines in the graph. One goes like this, and one is flat. The flat line are those that got the vaccine. The line that goes like this are the people that didn't get the vaccine, the ones that got the placebo. And I hope all of us will want to be on that flat line, getting the vaccine and reducing our risk of getting COVID as much as possible. So again, thank you for having me today.
All right, thank you, Dr. DeLisi and Dr. Cawley. At this point, if anybody has any questions for any of us, the floor is open.
what about the businesses and such that are actively not following your guidelines? What words do you have for them, and will enforcement be stepped up at all?
It will be, and if you know of somebody that's not using masks in businesses particularly, let us know. We'll be glad to send our livability officers around to remind them that they should be doing so. But I've spoken both with our livability department and our police department, and we have continued to write tickets and make due diligence in enforcing our mask ordinance. We will continue even more so.
Any word on the timeline, how long we'll be in phase 2, or does this depend on case numbers?
It just depends on the numbers. So if you go to our website, which I recommend you doing, that outlines all those key indicators that we follow, and we have green, yellow, and red. So everything now is in yellow and red, which is not good. So for most of those indicators, when you have a positive trend for 2 weeks consecutively, we will consider going back to phase 3. And then ultimately, of course, we're hoping to get finally to phase 4, which we'd never gotten to, which is in essence more back to normal.
Do you anticipate having to go even further back to phase 1, or do you think that this is the right step for right now?
I pray not. I hope not. I think if everybody pitches in and the vaccine gets distributed, that we will avoid having to go back to phase 1. Anyone else? So Dr. DeLisi and Dr. Cawley, thank you again to your organizations. I know Time Magazine likes to have their award every year of a man or the woman of the year. My vote for 2020 is the Healthcare Workers of America. They've done an incredible job, and I thank you both locally for the efforts that your employees and other healthcare professionals have taken. And again, I challenge our citizens and our business community as well to just step back and look at all of your safety protocols as it relates to COVID-19. Let's double down. We're getting the vaccine out. We got a few months ago. Let's do it as safely as possible so that those hospitalization numbers do not continue to rise. When they go up exceedingly, that's what puts our community at risk and our public health at risk as well. So once again, thank you for being with us today. God bless.
A brief recap there of what you were just watching. That was the City of Charleston special presser. Mayor John Tecklenburg announcing that city operations will be going back to a phase 2. We were in a phase 3 of reopening since about mid-October. For reference, some more information here. This has to do with CDC indicators having to track how many numbers of growth as far as COVID-19 cases in the low country. Dr. Pat Cawley from MUSC also saying that he's recommending people continue to get tested, social distance, wear their mask. Also saying if you are a high-risk person who has COVID-19, there is now life-saving medication that could be available to you. He's recommending that as well. News 2's Katie Augustine is there at the press conference. She will be covering this story and have a full report today starting at News 2 at 4 o'clock. Thanks for watching this special report.